Welcome to Scale Her Up, the show for female business owners and leaders who want to grow profitable, sustainable businesses without burning out. I'm Dr. Brenda Hector. I'm a business growth specialist helping women develop themselves and their businesses so they can achieve their goals and enjoy the lifestyle they dream of. In each episode, you'll hear inspiring stories, honest conversations, and practical strategies to help you start, grow, or scale your business. If you're new here, hit follow so you don't miss an episode, and come and join our Scale Her Up Facebook community to keep the conversation going. And the conversation today is with Leah
Athanassopoulos.
Athanassopoulos. Yeah. Leah, it's an absolute pleasure to have you on the show. You, I believe, are the owner and managing director of Alpha Hospital Group.
Yes, I am.
So tell me about Alpha Hospital Group. What is it that you do?
What is that we do? We started off primarily as a plastic surgery hospital. We were a clinic first before moving to a hospital, but our services have expanded quite a lot recently, and we've moved into women's health and fertility as well.
Okay.
So we're offering a lot more than we were to start. We've got, in our Aberdeen location, we've got 3 locations. We've got Aberdeen, Inverary, and Inverness. So we cover the north of Scotland in a way that's been really great, actually. But our Aberdeen is our main location. That's where our main hospital is. We have a mixture of aesthetics as well, GP services, the fertility, as I mentioned, women's health. And as we expand, we'd like to have some of those services in our other locations as well. Inverary is more non-surgical aesthetics. We do some minor surgery there. Inverness is the same, minor surgery, skin cancer, things like that, as well as aesthetics, as well as cosmetic things. A real mixture, but our primary business was always plastic surgery.
So tell me how you go, just explain to me that journey going from plastic surgery to fertility.
Yeah, I think that's probably down to me. I think the main plastic surgeon is my husband. So I've worked with my husband since the beginning, and we have a couple of other consultants on board as well. And I think for me, looking at the business and what we offer, I always felt that there was a need for more private healthcare. I'm not from the UK originally. I'm originally from the States. And I always felt that it was difficult to have, if you wanted to go get private healthcare anyway, just to go get like an MOT. I'm like, why is it so hard? And also, why is it so expensive? I think like when you could find it, it was always really expensive. So I wanted to be able to offer that. And I thought there was a gap in the market, which is why I expanded into women's health initially with GP services and now the fertility service, because there is nowhere up here that does it. We're the only ones, really.
Okay, so it's either you either go NHS or
Yeah,
you have
NHS,
to go,
or if you
down
want to go
south,
private,
right?
you have to go to Glasgow.
Okay.
Yeah, which is really difficult because women have follicle tracking. They need to do 3 times a week, Monday, Wednesday, Friday. So there's women before we opened that were traveling to Glasgow for that service.
Oh my goodness.
3 times a week. So you can see that there was a need.
Yeah.
So yeah, so that's a very new service, and I'm still learning a lot about that. And it came into when we started the women's health and the GP services around that, fertility naturally just came into that. And one of the GPs, we knew somebody that was involved in the fertility, and it just all happened really quickly. And before I could even really think about it, we were doing it. Yeah.
Okay. Yeah, it kind of makes sense, I suppose. The customer base is almost the same.
A lot of women. We do get a lot of men as well, but definitely it's primarily female customers. So our patients are, so there's, yeah. And I think with the menopause services as well, it's interesting because if you've got a patient coming in for some kind of plastic surgery that's elective, they might be talking in their consultation about the same symptoms that they've got with sort of menopause, and there's a crossover there. So you can just refer them internally to see the specialist about that. So yeah, it was a natural kind of progression, although it probably doesn't look like that on paper.
No, it makes sense to me. I understand.
It's natural. It happened. It worked. Yeah.
So the other thing that you mentioned that I wanted to understand a bit better was first you had a clinic and now you have a hospital. So
Yeah. What's the difference?
Hospital, yeah.
It has to do with the regulations. In a clinic, clinics are licensed to do lots of sort of non-surgical stuff, but also you can do surgical stuff in a clinic. And we were doing, as we were growing, because my husband at the time was the only plastic surgeon that we had, and he was still full-time NHS. So we were just part-time, had the clinic, just we didn't want to start really big because I think you can take on a big project and then it fails.
Mm.
And then you're stuck with rent and all these bills, overheads. So we started off small just to see, does this take off or not really? And that was the right thing to do because it did take off, but it allowed us to think, plan how we wanted it to look long term. So he eventually went part time with the NHS. And a few years ago, we actually totally left the NHS because he was so busy here. But moving from a clinic to a hospital, having a hospital allowed us to do general anesthetic cases.
Okay.
So it has to do with the types of cases. You can do much longer plastic surgery cases. So, more extensive things can happen and you can do more than one type of thing at the same time, if that makes sense. So that's a regulatory thing as well. So hospitals are very highly regulated and we we have monthly meetings with the health inspectors and it was a big shift, but in a good way, because actually it turned out that they were all really supportive. It's Health Improvement Scotland that regulates private healthcare in the UK, or in Scotland, sorry. It's different in England. But yeah, so that was a shift. The building had to be different. There was lots of requirements, regulatory requirements that needed to be different, but that it was the right thing to do. It was an investment, but it was the right thing to do.
So are all three hospitals, or are some of them still clinics?
Aberdeen, the hospital,
Yeah.
Inverurie, and Inverdesser clinics.
Okay. Yeah.
Yeah. Yeah.
Okay. Yeah. It's fascinating, actually. It's a really interesting. I've met lots of businesses and lots of different businesses on the podcast, but yeah, I've never had a hospital before, so it's good to
Yeah.
understand. But yeah, I'm going to be asking more questions about
That's
the
okay.
challenges and what you. So I'm assuming that the regulatory side, that's a significant challenge for you
Huge.
to, yeah.
Yeah. It's also the design of the space. We are on Carden Place, and the buildings on Carden Place are old granite buildings. They were originally houses. So, some of the walls, the granite is, I say, 3 foot thick, huge. Yeah. And we had to put in an oxygen pipeline when we moved in. So that's for when you're asleep, the anesthetic machine is breathing for you, shall we say, or helping you breathe. That had to all be piped in. So we have oxygen that's brought into the building, that was a huge thing. And getting that approved to the city council is one thing, you have to get approval for that. But also the high spec of the equipment needs to be amazing because what you're doing, you're putting people to sleep. You're
Lives are at stake, really.
absolutely. So it has to be the best of the best. And that's obviously highly regulated separately. So all of that stuff needs constant maintenance. There's an air system that's in the main theater. There's air changes per hour. So 25 air changes per hour, which any operating theater should have when you're doing GA cases. But getting that all organized, designing that, I did all of that. And I look back and I think, God, I was crazy. But there's companies that can do it for you. They'll come and they'll do all the design, but they charge you a lot of money. At the time, I just thought, there's no way I'm going to pay that. I'm going to figure this out myself. So I looked at all the regulations. I looked at the building codes, everything I need to do, and I did it myself. And I'm so glad I did because, gosh, I can quote the building still to this day because I memorized them. But yeah, yeah, there's lots to it. It's not just the building, it's the air system, it's the oxygen coming in. There's lots of things that are just so, yeah, complex things individually that need monitoring. They need constant maintenance. And if one of them goes out, we had an issue with the machine a couple weeks ago and we had to cancel surgery that day. And obviously people are devastated, but you cannot go ahead unless everything is working as it's supposed to be. Yeah, and everything has to be scratch. Yeah.
So what was your background then, Leah?
So my background was not in this, that's for sure. So I actually have still to this day, I still work part-time at the University of Aberdeen. So I'm a lecturer there and I teach counseling and psychotherapy. That's my background.
Okay.
That is what's interesting is I did psychology and then I trained as a therapist years ago, but understanding people has been really valuable in how I manage the staff, I think. Understanding group dynamics, understanding who's the best fit for a role when there's problems that come up. How do you navigate that? And I think my background has been really good for managing staff and managing in general. It's been really helpful. It's given me an insight into things that I would say that I I don't know if it would have been I don't know if we wouldn't have been if we would have been as successful if I didn't have that background information into people and how people tick. Same with how patients think. It's an understanding of human nature and what do people want? What are they saying? Sometimes people can talk a lot and say something, but that's not really what they're trying to say. There's something else underneath. And
Yeah.
You have to learn to hear people in a different way. Yeah, so that's been valuable background.
That comes up a lot actually. Like communication
Yes.
is really important in business, whether it's with your customers, with your
Yeah.
suppliers, with your staff. Yeah. It's
Yes.
yeah.
That's and I've done over the years, I've done training with staff about stuff because obviously, like I lecture, so I'm used to delivering material where the audience might not understand that something, and I have to create that and deliver that. So over the years, I've done training with staff, even conflict resolution. If somebody's upset, how do you deal with that? So that's all been really valuable. And I think one of the other things I always say to the staff, even the nurses sometimes, is listen to hear, don't listen to respond. That's a big thing. Is like really trying to hear the other person and understand what's the message they're trying to get across. What are they trying to say? What are they not saying? And actually just take the time to listen so that you can really hear them. It's not about listening to respond, if that makes sense. So, yeah.
I'm just thinking about the similarities between your two.
Careers.
Yeah.
Yeah.
It's
Yeah.
about there's a big part there about people feeling better about themselves.
Uh-huh.
Yeah. And whether that's removing a mole or getting something more a bigger cosmetic procedure or that women's health and fertility and everything
Mhm.
can be really devastating for people. So yeah, there is a bit of a what's the word? Like an overlap.
Crossover.
Right?
Crossover.
Yeah.
Yeah, I would definitely say so. Yeah, definitely. And I still see clients in private practice as well. So usually on a Friday, I see clients, and more I'm running out of time to do to do that. Actually,
I
I
was just
don't.
say that because we had a bit of a chat before we started recording as well. So you have you've got a business, you've
Yeah.
got a career as a lecturer, still doing some,
Yes, still doing that.
and you're about to have your third child.
Yeah,
How do you juggle it all? How do you manage?
I would say it's something I've learned over the years that you can. There are weeks where I'm really good at one thing and I'm not great at the other, and I'm okay with that. I'm okay with that. I think I finding a balance, people talk about having a balance, and balance isn't always realistic. You can't always do that. But I would say for me, my priority is always my family. That always comes first. When we first opened and we started to get busy, and especially when we became a hospital, I had a rule at home, which is still a rule. It's after we get home, we need to be with the kids. We need to be a family. And my God, is that difficult to do sometimes because you just want to get on your phone, you want to get on your laptop and finish stuff. I actually recently have stopped bringing my laptop home with me because I don't want the temptation there to go on
That's
it.
such a simple solution though, isn't it? Yeah, I've done it's not the same, but I've deleted all the social media apps from my
Yes,
phone
yeah.
so that social media is a tool for my business, but it can just get me sucked in. So if it's not there, can't
If
do
it's not
anything.
there, can't get
And
stuck.
yeah, if you leave your computer at work, then yeah, you can
Yeah,
be
because
best.
there were times when the kids would go to bed. For a number of years, I was awful for this. The kids would go to bed and they were little at the time. 7:30 was they were asleep. And I would get my computer out and I would work. I would work until 11 o'clock at night. And because I had so much to do. There was just so much to do in the beginning, and I just won't allow myself to do that anymore. There are things that can just wait, and I'm quite strict with myself. And I think with phones as well, I'm really quite strict with myself, but also with my husband about the phones at home because psychologically, when you're around children and you're on your phone all the time, what you're telling them is that this is more interesting than you.
Yeah.
And actually, I don't want my kids to have that message. So I'm really quite strict with that. It's no, put your phone away. If somebody needs to call us, you'll hear the ring and you can go get it. But I want my kids when they come home to feel like this is actual, you're important to me. I want to hear about your day. And I don't always get it right. And I obviously slip up sometimes. But on the whole, I try to have that philosophy about actually having engaging conversation with my kids and as a family, even trying to sit down and have dinner together, it can be like a real challenge. When you think, God, why is this so difficult? But striving, I think striving for that. And if you don't always get it right, that's okay. And you can't beat yourself up over these things, but it's a good goal to have. And I think the one of the other things about balancing things is in the last few years, I think getting it right with staff has made a huge difference to my life. Having the right people. when you have the wrong people and you're doing their job as well as your own, something has to, you need to make a change there, that they are not the right person for your business. I'm in a great position, like God knock on wood, that the people I have right now, they're actually doing their job. And that means that I can do my job and I can delegate things and do less than I used to do, which is so important. And
So,
it takes time to get there though.
yeah. Reading between the lines, it sounds like you've made some mistakes around
Oh, of
stuff.
course.
Yeah.
And you
What,
learn.
what have you learned?
I think this sounds terrible, but getting rid of the wrong people sooner is what I've learned to do. Is when somebody isn't right, you need to get rid of them. And I think being too emotional about business decisions is always a mistake. There are some things that you need to be slightly disconnected from emotionally and say, look, I'm not responsible for this person. They're actually here to do a job and they're not doing it. And it was actually my dad that gave me that advice like years ago. My dad owns a business. He's owned a business for God, 50 years and he just won't retire. And he's always said that to me. He's don't make decisions about your staff emotionally. Don't be emotional about the decisions because
Wow.
you need to think strategically. If somebody's not coming to work and actually doing their job and they're making your life more difficult, why are they still there? Why are you still paying their salary? And at first, I would keep people on board because you feel bad. You feel horrible. And you'd have to have these really awful conversations. And my job is to have awful conversations. And it's taken me a long time to make peace with that. And I'm the best person to do it. I'm probably the most qualified from my other background as well.
Yeah.
Not nice. You don't like to tell people that they're not doing their job. You don't like to pull people up. You don't want to, yeah, the whole disciplinary thing is really uncomfortable. And I think it's something I've learned as soon as there's an issue, I address it immediately because it doesn't go away. I think
And actually, it can impact other people as well. When
massively.
they see someone getting away with something that they
Uh-huh.
shouldn't be, then why should they be doing things right if someone else is not pulling their weight? Or, yeah.
Absolutely. And I think when there's toxic behavior and there's people that they don't have the right attitude, that has a negative effect on the team when you've got people not getting along. I've learned to address that immediately and say, and to mediate that, what's going on here? We can't have this is a professional environment and we all want to have a good life. I don't want to come to work and have two people that don't like each other that don't want to speak. So I think I've learned to address it immediately because it is not going to go away. In fact, it gets worse. So you
Yeah.
just got to address it. Got to dive in and address it. Yeah.
Tell me then, what have you learned about Leah on your journey as a business owner?
Oh, what have I learned about Leah? She's the person I always knew she was. I think I've learned that I'm made of tough stuff, and I always knew that. But I think you know that about yourself, that you get the evidence, you have the evidence behind you to show that. I've learned that I can be, I can make decisions that are tough, that are really hard decisions. I can do that and make the right decisions, make the right choices. I've learned that I can't do it all because nobody can. And I think that's something that's always a lesson for me is you can't do everything. You have to there has to be give and take a little bit. And yeah, I think for me, ultimately, it's also about being kind to yourself. I try to be kind to myself when I make a mistake. It's okay. Try to hold myself to the same standard I hold other people, and I would never beat somebody else up for making a mistake. Yeah, I think I've gotten to know myself in a different way, but in a way that I always knew I always knew that part of me was there in terms of owning a business and what it's like. And you do have to be unpopular sometimes, and that can be hard, but I'm okay with that. Yeah.
So, do you think you were always going to have a business? You said mentioned that your dad's an entrepreneur.
Yeah,
Oh,
I think so, always. And if it wasn't this, it'd be something else for
uh-huh.
sure. Because I grew up, I think when you have a family who owns a business and they're entrepreneurs, it's interesting. I think you see what it's really, and it's actually really hard. And I've always been very driven and um, had goals that maybe other people would say, "Oh gosh, that's a bit much. That's a lot." But when you want something bad enough, you go after it and you do it. But it's not just doing it, it's maintaining and sustaining it that's difficult. And I think that's what's hard about having a business is anybody can set up a business.
Yeah,
It's
you can't
things
get off the treadmill.
exactly.
Yeah.
It's sustaining it over time. And diversifying it and being resilient because things come up and learning from it. And also, there's times when you're going to make mistakes. You need to eat humble pie and you need to hold up your hand and say, okay, I messed up here, and being able to learn from your mistakes. But yeah, I think seeing my dad, he's given me great advice over the years. And I worked for my dad when I was a teenager. And my, I look back now and I laugh because it was the right thing to do. But at the time, I was always really annoyed about it. I would get paid the same thing everybody else did. And I remember thinking, I was 15, I was like, I should get paid more because isn't this our company? Why wouldn't I get paid at least a little bit more? And my dad always said, you're doing the same job as everybody else. Why the heck would I pay you more? And yeah, there was a real work ethic that was instilled in me growing up about stuff wasn't just handed. It was, no, you want that, you have to work for it. And that has served me well, actually. And getting little tidbits of advice over the years from my dad. A few years ago, I had something that had cropped up and I was like, oh my God, I don't know what to do. And I called my dad and he was so funny. He gave me great advice. It was brutal, but it was great. And that's nice to have somebody that you can ask. It's not that often I actually ask him about stuff anymore, but at the beginning, there was times where I'd be like, oh God, what do I do about this? And he could give it to me straight, shall we say.
So it's interesting you should say that and talk about the advice you had from him, because one of the questions that I often ask is, who's been there to support you?
Yeah, I would say about some HR questions. My dad is good
Yeah.
for human resource questions because as long as he's had a business, he has seen everything. And I would say my husband is the other support, although we do such different things. He doesn't have anything to do with the deal staff or the regulations or all the stuff that I deal with, the compliance stuff. That's me. But he has been very helpful in if there's a compliance question, and I just because my background wasn't always in healthcare, what the heck is this? And sometimes I need a translation because I'm not originally from here. Like, why do you do this in the UK or Scotland? What is this? And I'll have a question. I'm like, tell me, I
So
need to
you'll
know.
have like translate it from a
Yeah.
healthcare
Yeah.
thing to a layman's terms, or to from
Yeah.
a local thing to a,
Yes.
yeah, that
Yeah.
makes
So he'll
sense.
sometimes translate for me because that doesn't make any sense to me. What is that? So that's helpful. And as well as being a support, having a business together is challenging because
Yes. That's my next question. You're
hugely challenging,
that to me. Yeah.
hugely challenging. And I would say it's probably taken us definitely a few years to get the rhythm of that correct in the way that it works. Because you can have, like I said, I do very different things to him, but having that professional relationship, it's definitely taken time to learn the flow of that and what works for us because you don't want to go home and talk about work all the time. And that links to what I was saying earlier. And if he's more guilty than I am of bringing up work, actually, and I will say, stop it. I'm quite abrupt. I'm like, do not talk about work. I do not want to talk about work. He's, oh, sorry, I forgot. It's because it'll be in his mind. And if we didn't work together, I would have been quite happy probably in those instances to say, yeah, tell me about that thing that you're thinking about with work. But because we're linked, it's linked to what I do every day. I'm like, I don't want to hear about it. Tell somebody else.
Bring it to the meeting.
Exactly. But yes, there's a balance to be added and it's difficult, but we've learned how to do that actually, which is great because it was hard in the beginning because it was all the time in the beginning. Yeah.
You're talking about in the beginning. I realised I've missed an important question there. How long have you been in business?
So we started in 2019.
Okay.
2019, which feels
God.
like a really long time ago, but I think a lot happened. Our kids were really little then. We've got two boys and they were little then. So it was balancing that. And it wasn't as busy as it is now, but it was a lot to take on and deal with. So yeah, so 2019. So it was right lockdown time because
Yeah.
those were
How
stressful
did you
time.
navigate that then? Because
That
yeah,
was tricky.
yeah.
That was tricky. So we had just opened and obviously we'd put money into fitting the building out. We had just started to hire staff, so staff were furloughed at the time.
I guess it was good that you both had
Yeah,
another job, but yeah.
because he was in the NHS still, and he was going into work. Gosh, I remember he was practically in a hazmat suit, like, going in because at the time with what he was doing, he was plastic surgery department. Anything elective or not life and death was obviously canceled, but there was a lot of the cancer stuff that was all still happening and how they were doing that, but it was, yeah, very strange time, I'm sure it was for everybody, but he would go up to the hospital and I was obviously at home, but trying to keep the business going from home because we couldn't see patients, so we had to close because it was It wasn't emergency stuff. We did lots of stuff online. Consultations have to be in person for any medical procedure. But what we did was we had online consultations. And then once we reopened, we saw those same people in person. So they could ask a lot of questions. You could talk about the procedure that they wanted. You could have that consultation virtually, but then they would be booked in for when we reopened, which was difficult because we didn't know when that was. So I remember I had this like list, this never ending list of people to contact when we got the okay that we were allowed to open. Because any clinic was in the same position. You couldn't open. Yeah. So that was wild.
And we talked about staff and staff mistakes and things. How many staff do you have now?
Oh, I should have thought about that before I came on here. Oh God. Like Inverness, Aberdeen, Brewery. I would say it ranges. Some of the staff we have in Aberdeen are like some of our nurses are bank nurses, so they're not permanent full-time staff. They come in for 2 days a week. So probably 25 to 30, I would say, probably in total. And like the anesthetists that we use are the same. So they're not employed, they're self-contracted. Self-employed is contracted and they come in to do the cases. But yeah, probably around there, I would guess. That might be on the high end. I'd need to check. It seems about
That's all
right.
right. That's all right. It was just to give us an idea of what you're
Yeah,
managing
it's about
there.
that.
Yeah.
Because obviously we've got 3 locations. Yeah.
So what advice would you give to another woman looking to start and scale their business?
Depends on what they're doing, I think. It depends on the industry, but I suppose like overarching advice is just do it. Go for it. I think if you're thinking about starting up a business, I think you should do it because if you structure it in a way that you can't lose, there's a possibility of a huge gain there. And I think set it up so that if it's not successful, that's okay. You're still going to be fine. And I think it's the scale in which you start, I think is really important because you have to generate traction. You need to generate clients, whatever it is that you do. And nowadays marketing looks very differently as well. I think you have to wrap your head around marketing. I think you have to ask yourself, how am I going to get people in the door? How are people going to hear about me? That's a huge thing, is how you can set up a business, but actually how do you get your clients?
A
Your
lot of
customers.
people, we talk about that a lot as action coaches. A lot of business owners don't realize they're going to actually have to sell.
Yeah.
Yeah, that I've got this great product or service and people are going to
Yeah.
come to me and but they don't. You have to find
They
them.
don't. And marketing's really expensive. So you have to think about that. And it takes time before people come to you by word of mouth. And that's a stream of people that come word of mouth. And that all goes down to customer service. If people have a great experience, they're going to tell everybody about it. How do you manage it when people don't have a good customer experience and they tell everybody you're crap?
Yeah.
You got to learn how to manage that as well. So that can be really difficult and quite emotional. That can feel really devastating when somebody's not happy because you tried your best and it just wasn't it didn't work out how they wanted it. That can be really difficult. But yeah, I think navigating the marketing and actually how are you going to get your customers? And if you don't know anything about social media is like a minefield of navigating that. I tried to do it myself for years and then finally we've got 2 of our staff in-house that help with that are great. And they say things and I'm like, "Oh my God, I didn't even know that was a thing." I feel so
Yeah.
completely and I think that's the other thing is you don't have to be a specialist in everything. You have to outsource some stuff. And yeah, so understanding that because marketing isn't just about social media. There's other ways that you market to customers and people hear about you and that finding your ideal customer and where are they going to hear about you and then that's your marketing strategy. But yeah, but I think some people we hear stories, they take out big loans, they get large premises to try to start and you don't actually need to start like that. You can start quite small and I think that would be my advice. Start small but do it.
Yeah, it takes the risk out of it, doesn't it?
Yeah.
Run it like you did, run it alongside your job
Yeah.
until you knew that you had the traction to step away.
Yeah, it's the most realistic thing to do, and it takes away the pressure of, "Oh my god, if this fails, it's catastrophic." I think it's more fun if it's also a little safe in the beginning.
How much fun is it?
It's fun sometimes, and sometimes it's not. depends. It is, I would always choose to do it. I would always say. But I think one of the misunderstandings about owning your own business is that, oh, you have the freedom to do whatever you want. You can choose when you work, when you don't work. That is not true. You are an employee like everybody else. And that's the truth. You really are. You're an employee. You work for the company and you work for the staff. You work for the business. And you can't just take off whenever you want. And you can't just do whatever you want. And I think when I hear people say that, I think, well, what business do you have? Because that's what I should have got into. But yeah, that's
I was talking to someone on one of these podcasts just the other day who was telling me how when she had her baby, she
Mhm.
was a bit of a traumatic birth, and
Yeah.
she in her hospital bed on the phone with a supplier. Like when the business, you're not getting maternity leave from the business in the same way as you
No.
are from the university. No.
No, and that was something I was just talking about, and I'm due in 4 weeks, and I'm here today working, and I went on maternity leave from the university in February, and I'll be off for a year there, and I was just talking to the operations manager, and I'm saying, "Okay, what do we need to do? What trying to plan because I wanna obviously have some time off, but I'll be working up until I go into labor. I'm not gonna just sit home like there's nothing to do. There's a lot to do." Yeah. But I think part of the time coming up to that is carving out. I can I have the ability to carve out the time. So it's doing that, sort of making sure all the stuff that I need to do is done so that I can have at least a month off. But that doesn't mean I won't be on my phone in that month. There'll be stuff that I will absolutely have to do. It'll be financial, whatever. I'll have to pay some invoice or something. So yeah, it's a balancing act.
So I talk about the juggle. Yeah.
Mm.
It's always the juggle, isn't it? There's so
It
many
is.
balls, and yeah. Some are rubber and some are glass, and you just need to, it's okay to drop, and some are rubber at some times and they're glass at other times. And
Yes.
yeah.
That's a good way to put it. Rubber and glass, I would definitely say that.
Leah, is there anything that I haven't asked you that I should have done? Anything you'd like to add to the conversation?
No, I don't think so. I think that is a general overview of, yeah, the business of me, my life, I would say.
What's the next goal for the business then? Where are you taking it next?
Where am I taking it? I was just talking about this. I think I would like to take some of the services that we offer here in Aberdeen and expand them to our Inverness location. That's tricky because of the distance. Anything that's far away or hard to get to, it's harder to manage. It's harder to set up new services. But that's definitely something I'd like to do is expand so that things like the fertility that can be done. That can be done in Inverness. It's just I need the setup for that has to be there. We have to buy equipment, which is very expensive. Ultrasound machines are not cheap. And then obviously have the staff there. So how we do that, that's in my mind. That would be good. Because patients, again, although they don't have to go to Glasgow, those patients, Highlands and Islands, have to come to Aberdeen now. It's still a distance for people. So yeah, to do that, like to expand the services that we offer in Inverness so that it's, yeah, it matches more of what we're doing here, which is, that takes time. And because although the business exists, it's when you offer a new service in a place like Inverness, say when we're based in Aberdeen, it's like branching into a totally, like you set up a new business all over again.
Yeah.
It's nobody's heard about it. Nobody knows that you do that or that it's any good or there's nothing for people. So you have to do a whole marketing scheme. And so it's tricky actually to, even though we're the same company and we're busy in Aberdeen for one service, it doesn't mean we'll be busy for that service in Inverness. So that's something that I've learned that it's a different market. People are different there. It's a different marketing strategy. Yeah. It's a different clientele.
You have to understand the people, and even the difference between the people in Aberdeen compared
Yes.
to Inverness is, yeah.
Absolutely, absolutely, and is there an actual market for that, or is that just what I want? I think there's a market, but I have to do some more research on that, but I think it would be good to be able to offer that. Maybe not as much as we offer it here, but because it's a smaller facility, but it would still be good to be able to have that there. But you can set up a new service and you have no patients, you have no clients, and it takes time to build that up, so you have to there's always a loss in the beginning where you're just the tumbleweed. You set it up and then
Yeah, and
Nobody
what time frame are you willing to give it to
Mhm.
break even and to start generating?
Exactly. And you have to make that decision and you either pull the plug or just wait it out. So I think some of the stuff we do here, we do the skin cancer services, same type of things that are like local, smaller procedures. We do upper eyelids there. Blepharoplasty is one of our like most popular procedures, but anything you can have under local, we don't need to be asleep, you can have up there. But the women's health and the fertility and all of that we haven't quite set that up there yet. But I think that's probably next after I have the baby.
Times. Yeah.
After
Focus
I
on
have the
that for
baby, then
now.
I come
Yeah.
back.
Do you know what you're having?
It's a girl. It's a girl.
Oh, nice. So you got two boys
2
already.
boys, yeah. So I'm very excited. I actually went to see the consultant today. Yes, it's all very real, and it's going to be here before I can believe it. So 4 weeks is going to fly.
Yeah. I have two girls, so yeah. Hang on your hat.
That's what everybody keeps telling me. So
Leah, it's been an absolute pleasure talking to you today. Thank you so much for,
thank you. Thanks for having me. Thank
yeah,
you very much.
I really appreciate your time. Thank you to you for listening to Scale Her Up. If you enjoyed this episode, follow the show and leave a review. It helps more female business owners find us. Come and join our Scale Her Up Facebook community to get support, accountability, and connection with women who get it. And remember, only 1 in 3 UK entrepreneurs are female, and men are still 5 times more likely to scale their business beyond £1 million in turnover than women. When we start and scale our businesses to the same extent as men, we'll add 250 billion to the UK economy and create millions of jobs. Ladies, you can do it, and your business can make a massive difference.